Well, I hope you had a happy holiday season. The holiday seasons are wonderful, but they do bring a lot of stress. A lot of people develop some different feelings, some depression, some anxiety. So I thought it was a really good opportunity for us to talk about mental health issues and exactly how the 911 system and the emergency department figures into that. So we get a lot of questions about mental health and the emergencies, like this one.
Hello, Dr. K. My name is Sierra Batchian Johnson. I'm a social worker for the Department of Family Protective Services. I live in the Spring Tomball area. And my question for you is, why is the end of the year a depressing time for a lot of individuals out here? And also, my other question for you is, what resources are available to address this issue?
Well, it's a great question because we definitely see more mental health crises this time of year. One of the resources we have is the HART Team. I've got Courtney Morales here with the HART Team. She is the program coordinator. And if you could introduce yourself and tell us a little bit about the program.
Thank you, Dr. K. The HART program is the Holistic Assistance Response Team, and we're an alternative 911 response team. So if you call 911 or the Harris County Sheriff's Office non-emergency line within Harris County Sheriff's Office districts, we can respond to anything non-violent, non-emergent. And things like that are typically mental health. We deal with a lot of mental health. And this time of year, money's tight. We just got through the holidays. And you need some social services. We can get there. We can come out, meet you, and get you those services. So normally when you call 911, you get fire, EMS, or police. We're an alternative team that can assist in different areas such as mental health. The different criteria that would make a HART team more appropriate than police, fire, or EMS would be that it's non-violent and non-emergent is a good time for us to respond. We try to keep it really simple, so as long as it's non-emergent, non-violent, our dispatch operators will screen the call, and if it meets the criteria, it will be dispatched to a HART responding team.
So when the public calls 911, we are going to send an ambulance. We're going to start a unit rolling that way. We're going to get additional information. The caller is going to stay online, either with a national crisis hotline or possibly the sheriff, depending if it's a third-party caller. We are going to involve the HART team, and both of us are going to start to respond to that situation.
That's right, Dr. Kovar. And when we arrive on scene, we have a HART team that'll be able to help you. We have EMTs such as Anai and Sam here, as well as a crisis intervention specialist like Antoine. And when we're on scene, the EMTs will assess the medical needs of the resident, and our crisis intervention specialist will be able to assess the social welfare needs and mental health needs of the person.
When I get on scene as an EMT, it's my job to assess the scene to see if we need a higher level of care. Also, I determine what needs the patient has medically and see if we can even help get them medical resources as well.
So, doctor, when I arrive on scene, one of the many things I do as an emergency medical technician is initially seeing my patient. If it's a patient, trying to establish as to what criteria they meet. Is it a mental health call? Is it an altered mental status? To what extent? Along with doing my basic assessment and vitals, I'm able to go ahead and also say the patient needs to be transferred to an emergency department. I'm able to also get that transfer sheet, transfer everything for our responding EMS companies that are going to be corresponding with us. My assessment also includes trying to establish whether or not a patient meets criteria to be an inpatient farther than getting seen at a hospital within the emergency department. Maybe they need further care than that we could provide, that the ER could provide. So every case is different. Based on my professional opinion, when I arrive on scene, I'm able to see whether a patient should be admitted as a emergency admit or whether a patient should go to a psychiatric facility hold. The situation is different. It just depends on the nature of the call.
Hey, Dr. K. My name is Antoine. I'm a crisis intervention specialist supervisor. What I do is I supervise other crisis intervention specialists or CISs, and what we do is provide information as well as resources to those that are experiencing social welfare or behavioral health and mental health issues. Some of those social welfare services can include food banks, shelter, warming centers for the cold months, and also cooling centers for the hot months. So what does social welfare mean? That falls under the umbrella of speaking to neurodivergent individuals with autism or other mental health diagnoses. Also, we're specially trained to de-escalate individuals who are experiencing extreme emotion so that they can get the resources and information that they need. And finally, not only do we assist those individuals that are experiencing some type of distress, but we also assist their families and friends that may also be impacted by the situation, to provide them with not only free resources, but also personally, I like to destigmatize the conversation surrounding mental health so they can get the information and resources they need.
What we really want people to walk away knowing about the HART program is that we're for those in-between moments between normal life and life-threatening emergencies. Things that law enforcement, EMS, and fire just aren't necessarily appropriate or the correct response for.
If you'd like to request the HART services, call 911. We're going to connect you. So we'd like to thank folks from the HART team here. Tremendous services. So if the season's overwhelming, if you're having issues, crisis, etc., if you call 911, we're going to connect you. We're going to get everything taken care of. We're there for you. For Harris County ESD 11 Mobile Healthcare, I'm Dr. Jake Robach.